All right, Kevin back with you for another episode of the $1 Million Relationships Podcast. And today I'm here with Jean Foot. Jean, welcome. So awesome to have you on the show today.
And it's so awesome to be here with you, Kevin. Thank you very much. I appreciate you and your time and the your podcast. So there you go.
Well, I tell you, I have been looking forward to this conversation today. You and I got to connect before and get to know each other a little bit. And then through that, I was, oh, yeah, I definitely want to interview Jean for the podcast. And I want to start off by just honoring Sarah Snyder because Sarah is the one who connected you and I. And without her, you and I may have never even met. And so, and what a testament right there to the power of right relationships because that's what this podcast is all about. And so, Sarah, if you happen to be listening to this, thank you so much for getting Jean and I connected. And I just want to start, Jean. I want to turn it over to you, and I want you to share a little bit about the work you do, who you serve, and what inspires you most about the work you do and the impact you get to make.
Thank you very much. I think you said an important point. One of the things I do believe in strongly is that sometimes relationships and opportunities are by chance, like you're in the right place at the right time or a door opens up. And one of those relationships, which we're addressed later, is one of those moments for me where I was just, I believe, happened to be in the right place at the right time. And it came from me wanting to be of service somewhere and then ended up somewhere else completely. So I just wanted to
Wow.
address that. So I am the founder of the Recovery Concierge, and the Recovery Concierge is a boutique mental health, addiction, and trauma navigation agency. Basically, it's a bespoke boutique where we match people to the right services
Okay.
and the right treatment plans. And we have a cadre of services, and we really look at what is the appropriate mix for each client. Okay, so it could be that they do need an intervention and they need to go to treatment. And intervention is not that nasty thing that you see on TV. It's invitational, it's compassionate, it's non-stigmatizing, and it's a very gentle approach. That's how we work. And it could be coaching, it could be counseling. Everybody has a different degree of readiness and ability to, depending on what their needs are, and we actually match them appropriately.
Okay. Okay. How long have you been doing this kind of work, Sean?
Um, so that's interesting. So it's my second career, obviously. If you
Okay.
can look at me, you'll know that. But so I've been doing this for the last, I think I've been doing it most of my life, the last 30 years informally, but 15 in professionally. Yes, in a
Okay.
professional capacity. Yes.
Okay. How did you happen to get into doing this kind of work?
Okay. So here we go.
Okay.
I
I can tell
believe my
there's a good
life.
story here.
Yes, it's a good story. My life chose me, not me choosing it. So, it's interesting because I grew up in the early 60s in London, England, in an environment where children should be seen and not heard, a middle class family, really good. But there was a lot of trauma and chaos going on in my family through no fault. Baby sister died at the age of 4. Sorry, when I was 4 years old, and the baby was a little baby. And what happened was for me from there, it was a stepbrother who was sexually abused me, and grew up with a tremendous amount of trauma. So why is that relevant? It was relevant because at a very young age, I said to myself, I have to do this solo. And doing this solo means that I don't need anybody. And I became incredibly self-reliant and determined. And I literally fell into substances at a very young age because that's how I managed. That was the only tool I had. I didn't have any emotional regulation tools at the time.
Okay.
Treatment, nobody knew what trauma was in the 60s, 70s, 80s, 90s, early 2000s. It took like a long time I came way before it was trendy. So let's put it that way. So I came at a time where literally it was, there weren't services for what I needed. And so through my own recovery process, I found I was at a critical juncture. And the juncture was I was 7 years sober. And I thought, if this is all my life's going to be, I don't want any part of this. And
Mm.
so I was frozen in my body. I had literally no medication. I probably should have been medicated, no diagnosis, nothing. Not that I was looking for that, but I was looking for support because my life looked picture perfect on the outside, but inside it felt so empty and I was in so much emotional pain. And then I had an
Wow.
epiphany. And the epiphany was there's no one who's coming to save you. You better figure this out yourself. And so I
Mhm.
just dove into everything. I dove into everything from peak performance to emotional healing to trauma to addiction to mental health. And I just consumed everything until I found a solution that really worked for me. And from there, I started to put my own cadre of what I thought was, it was almost like this like mixture of optimal tools to
Okay.
become a proprietary method, which is what I use now.
Okay. Gotcha. Gotcha. Wow. So this whole thing was born out of, man, I just got to figure out my own life here and stuff. and my
No
and just
one's coming to save you, Kevin.
yeah,
No one's
yeah,
coming to
right.
save us. So you better figure it out, right? That's and the
yeah.
truth is, like, everybody's doing the best they can. So there's no blame here, but one has to take responsibility. Would I have come willingly? Probably not. But I knew that there was a time in my life where something was more important to me than me, and that was my children. And that was a catalyst for me. I wanted to do this differently than my family had done. I was in so much emotional pain. They were the most important thing in my life, and I chose them. So I made sacrifices at a very young age. I was in my early 30s at the time. And this was in
Wow.
the early 90s.
Okay. Okay. Wow. Wow. So what is, and we don't have to name names or anything like that, but what is a result that you've helped a client get that you're just really incredibly proud of, Jean?
There's many. Thank you for asking.
I'll bet there is.
I do what we call mental health triage, right? I think really what I do is I really have innovated something that wasn't there for me. And so when you look at what would have wanted, whether
Uh-huh.
it was for myself or later on for my children, which came from my own teenage children at a certain time in their life, I looked at where were the gaps systemically. And there are gaps systemically. There's no question about that. And so I think one of the proudest moments I've ever had was being in, I was looking for a place to volunteer. And so I went to this place to volunteer, and somebody pointed me to go to Sunnybrook Hospital. And so I said, okay, I had no idea what I was doing. I really didn't know. I just felt like I wanted to be of service. I really wanted to help reduce suffering for people. And this brilliant psychiatrist by the name of Dr. Anthony Levitt, who at the time was chief of brain sciences at this hospital in Toronto for over 10,000 employees, was looking at a pilot program to figure out why parents like myself had navigated their children to the US for treatment for mental health and addiction care.
Okay.
So I went to this town hall meeting, and for there, the most life defining moment changed for me at that time. So they were looking at trying to figure out why people were discharged from the hospital and why we went to the States. We shared our stories. And for there, he said, we're going to do something about this. We're going to change this right now. And we started like a pilot program, a startup,
Okay.
and we managed to get funding from philanthropy within the hospital. And I was part of that. It was literally, and he asked me to chair this program and find some people to help me support and grow it. And it was really a lived experience informed program with clinical expertise. And
Okay.
so what we did was back in the day, we did everything. We literally built the plane while we were flying it. We hired people. We went to philanthropy. I went visited every stakeholder in the mental health and addiction treatment stakeholder in Toronto. We even defined like what are the metrics we're looking for. Like we were just so involved, and he gave us agency. And that was one of the things that I was really admirable about this physician. He was a brilliant psychiatrist. He gave us agency. He felt that he could learn from us, people who have actually been in the trenches and have been failed by the system. And that's what I thought was so remarkable about Dr. Levitt. And he still is to this day for that reason. I think he's the most humble, brilliant mind I've ever worked with.
Wow.
And so I had the privilege of working across from him, literally some in the early days, 30 hours a week.
Mhm.
And literally, I was working for free because I was just so in love with what I was doing and giving back and creating something better for those who come behind us.
Yeah.
And it was just fantastic.
Wow. Wow. that I'm sure that early on experience really just kind of opened your own mind to like what would really be possible and stuff, and that you could really serve people in such a powerful way and stuff. And
Well, one of the things that I found interesting was, and it became apparent at the time, but I don't know if people would willingly admit it, was that people didn't know what to do in those situations.
Mhm.
And here was this brilliant psychiatrist admitting it. I don't know. We need to do better. We're failing people. And usually that sort of thing gets, hidden, right? Like
Sure.
we're the professionals, we're the experts,
Yeah,
we know
we're
what
supposed to
to do.
know what
We're
to.
supposed to know. That wasn't the case. It clearly is. Like there's not a clear defined pathway when someone's in crisis. And so what happens is, we know what to do with, broken hearts and like cardiology or broken bones, but we don't know what to do with broken hearts. It's a very nuanced, non-prescriptive process. And so you need to meet a client where they're at or a patient where they're at in order to help move them along. And too often, I think it's a top-down approach where we're telling people. And some of us are experts in our own life. We know better. And so we have to allow the patient, the client to be part of that process. Otherwise, we're going to lose them.
Yeah. 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 Wow. Yeah. It's interesting because, like, yeah, so much of my work is just spent asking questions and making discoveries with people and just hearing them out and what are they working on? What are they trying to accomplish? And so you have the same kinds of conversations with people and just and what's so interesting, even though the application is different. I know in my world, I can't tell you how many times people have said, "Man, Kevin, I just feel so seen when I'm around you." And I got to admit now that people in your world are feeling the same exact way.
Well, it's interesting you say that because rapport is the number one indicator of success. People think it's a therapeutic expertise. It's not.
Okay.
Okay, that's important. Like, I'm not saying that's not an important consideration, but if you don't have rapport with someone, you can't go anywhere. Even in family dynamics, you've got a
Sure.
relationship that's challenged or whatever, you need to have rapport. I just had the privilege of, before speaking with you, of speaking with a client who goes back 40 years from the insurance business I was just in,
Wow.
a family business that I own. And she called, and it was as heartwarming for her as it was for us because we have history. And they said she needed expertise and she needed some guidance. And there was implicit trust there. There was,
Yeah.
he's not like, she's not shopping around looking for other people.
That's
She
right.
goes, I've got my people.
Yeah.
I know I can trust them.
Yep.
We are relationship based people, which is exactly what you are. I know that about you. And it's about relationship based care in this situation in the work that I do.
Yeah.
It's more important what the relationship is because that's the where we start and we can move anywhere if we have a relationship,
Yeah.
but
Yeah.
we can't if there isn't.
Absolutely. Absolutely. Well, and what a perfect segue into the next question that I want to ask you, because I do want to start focusing on relationships here. And so, have you ever been introduced to a person or persons who completely changed the course of your life or your business, so much so that much of what you have today would not be possible if not for this person or persons? And I'm just really excited to hear your story and your experience around this topic of relationships.
Well, I think the first person so the answer is yes. And I think I have two people in mind. One was my
Okay.
father. His ethics, his sense of humor, his values, I was fortunate enough to receive from him, but I also was had the gift of mentorship. I was in my early 20s. I didn't want to go to university, and he said to me, "What are you going to do with your life?" And I said, "I don't know." I was working in the bank, and at that time, he says, "You want to come into business?" And I thought, do I really want to go into the insurance business in the 80s? I was a female. The females were still wearing skirts in those days. They weren't even wearing pants yet. And so he was a fantastic mentor. I probably didn't like every aspect of it at the same time, but he was a fantastic mentor in that he taught me about sales, and sales is about guiding people in a process. It's not a really about, you know, coercing them and slamming them over the head with what, look at this, look at this, look at this. It was really, and he really taught me that you're showing them a process. Either they want it or they don't want it. They still have the problem regardless, right? And he taught me about ethics because there's lots of people in life who, sorry, my earphone just fell out. There's lots of people in life who miss that, especially today. I think today is a very different world than probably the world you and I grew up in. And I think ethics and morality is at an all-time low. And the more I talk about it, whether it's with my husband or with people like yourself, I think, oh my goodness, I sound like my parents because they were so old-fashioned. But you know what? It is an important thing in life. Like, you have to have some benchmark of
Yeah.
morality
Yeah.
in business or in relational beings between people.
Yeah.
And I think that is being compromised tremendously nowadays.
Yeah. Yeah.
And
It
so
is. And you hear so many people say, you use that saying that, well, it's just business, And it's like, no, that is your excuse for doing whatever bad behavior you've done or getting ready to do. And so, and you're so right. I mean, we are definitely in a trust recession. And with our AI world, and the more AI progresses, the more that is going to be the case and stuff. And I'll tell you, people are looking desperately for just meaningful, real connection with people that they can trust. You know and and so I mean, yeah, I don't think that sounds old fashioned at all. And as entrepreneurs, it's becoming more difficult to just even be able to get to that conversation, that real meaningful conversation, that where we can ask questions and find out, does this person have a problem that I can solve? And if so, what would that look like? And how might I be able to help them? And even just getting to that place, it seems like such a Herculean task anymore because of everything that's going on.
I agree. It stems from values. And I just want to come full circle around the insurance and my father being a mentor.
Yeah.
We are into third generations in our clients acquisitions. So
Wow.
yeah, so myself was a second generation. We have our
Uh-huh.
son in the business, third generation. But when we're dealing with corporate benefits with our organizations, they're bringing in their young ones as well. Like they're into third generation. But I think the important takeaway from this is the values. The
Yes.
values are
Yeah.
coming from within the structure of the family or the organization. And they're saying, listen, we've been dealing with these people for a long time, and we'd like you to continue that. And if we weren't relationship based, it would be a parent and they would probably jump ship,
Yeah.
right? And they would bring in their own people.
Yeah.
But because we are, they recognize that. And I think that's an important value they're going to live on and play forward as well with their next generation.
Yeah.
So I think it's something that is maybe intrinsic to people like yourself and me, but I don't know if this young generation gets that because we live in a different world.
Yeah. 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 Yeah, you could be totally right about that. And, but having that alignment of interests and values, and then when we couple that with that, there's just that we have trust in someone in both their character and their competence. And when those four things come together, that's the magic spot. That's the sweet spot. That's where that real meaningful conversation can just take place and stuff. And like you said, anybody, somebody who's been with you for 30 years, that trust is there. They have trust in not only your character, but in your competence to be able to help not only them, but anyone that they might refer to you. They're referring them to you because they feel that you might be able to help the person that they're referring and stuff. And that you are very competent in doing what you do, and you are trustworthy because they've had this long experience with you and had that experience.
One of the lessons 100% my father taught me was you win on price, you lose on price.
Yeah,
Because, there's always going to be price out there, but
totally.
for how long, right? It can be short-lived. It may look attractive in the beginning, but maybe not for sustainable.
Yeah.
Um, so yes, I think I didn't realize it at the time because I speak about him in a way that, we're carrying on a third generation family business now. And this is not the only relationship that has changed my life dramatically. But what I recognize now is everything that I stand for, which is integrity, kindness, um, vulnerability, transparency, has really shaped who I became. I had no idea at the time that when this was happening, that this is who I would become, and it would mean so much to other people later on in life.
Yeah. Yeah. Well, you mentioned that there was one other person that you wanted to honor in addition to your father. I want to make sure I give you the opportunity to do that as well.
Thank you. So, Dr. Anthony Levitt, by hands down, um, he was chief of psychiatry at this Sunnybrook Hospital in Toronto, and I think he's as loved as I would say, not only in by his peers as well. Brilliant mind, creative, gave agency to people who weren't clinically trained to want to listen and learn from them. What had they experienced that went so wrong that they can try to learn and do better from? And I was just, not just myself, but my colleagues as well. We were just in awe of what this man, how much agency he gave us to really learn from us rather than the other way around, because I think in many medical professions, there's this top down approach where, they're the experts, they know everything. And I think there was such a beautiful humility about him that he wanted to learn. Because obviously, if people are taking their young children to the States to be treated for mental health and addiction and not servicing them in Toronto and their youth, then we have a big problem here.
Yeah.
And furthermore, we did something about it. We built this grassroots organization which has been going now for over since 2012.
Okay.
And it has served thousands and thousands of families. It has funding, it has clinical research, clinical outcomes, evidence based outcomes. It's a leader in the agency and in the industry. And I remember one of the things he used to say, and I think he would be totally okay with me saying this. He says, the government leads by following. He did something. He took an initiative and wanted to learn and start. And now the government is following, right? They are learning, and there are leaders, just not nationally, but internationally, with this model of care.
Wow.
Mhm.
Wow. That is really something. I mean, man, talk about making a powerful impact. Yeah. Wow. Well, so I want you to think, and I'm sure you could come up with lots of examples for this, Sean. But what is an example of a situation where you personally got to make a really big impact, and yet at the same time, and maybe even in the moment, maybe it surprised you a little bit, like, wow, look what just happened there. And yet you also know that would have never been possible if not for your relationship with either one of the two people that you've talked about today. What's an example of something like that?
I think I've been in a situations many times with clients where had I not been there or in the right moment, or we had not intervened and taken them to hospital, they wouldn't be here today. And I don't say that lightly because I meet people in their darkest moments and excuse me, and it could be an intervention where they end up at the hospital. We've like some of them stories sound funny at the time because there's a little bit of humor attached to it because it's so crazy. You wonder how serious, how it could be serious, right? But at the same time, if you really dial into it, there's this very serious moment of if someone doesn't answer the door or a wellness check is not done or there's not that level of accountability to make sure that they don't self-destruct, that could have a very fatal consequence. And the testimonials that I have from family members, mostly family members, I'm not sure clients always appreciate me until much later in life, but definitely family members do. You literally saved my daughter's life. And sometimes you got to do some heavy lifting, but these people change and end up flourishing, but everybody does it in their own timeline. And I think we have to respect that too. Not everybody's going to come and do it on a top down approach, authoritarian approach. Like, this is what I say you need to do. This is what you're going to do and do it now, right? Some people just need more time. And we have what we call a compassionate persistence on how we do that. We just stay with them and stay with them until we get what we need.
Yeah. Wow. Wow. So I'm curious, do you guys serve clients around the country and even around the world? Yeah.
Absolutely.
Yeah.
Yeah, we go where needed.
Okay.
100%.
Okay. Wow. Well, so for anybody that's listening to this and like thinking to themselves, wow, Kevin, I just really appreciate Jeanne. I really appreciate what she shared and how she shows up, and maybe they're thinking they might know somebody that man, she might be able to help us in our situation. Any websites, any resources we can share with folks?
Absolutely. I would suggest reach out to info at the Recovery Concierge if you have a direct need. You can go to the recoveryconcierge.com. That's the website. There is a book on how to navigate families. We're working on a scorecard for professionals right now so that they can enhance their skills and knowledge as how to navigate and therapeutically match appropriately. And yeah, there's lots of resources.
Awesome. Awesome. Is there any last thing that you feel led to share, John, before we call it a wrap?
Yeah, I think that we need to really look at our part in ourselves relationally. Like, we all bring something to relationships, and I think we're quick to point our fingers at the other person. And the closer the relationships, especially the more intimate, like partners, marriage, spouses, children, parents, they're going to be messy. Those are the people who trigger us the most. But I
Yeah.
think triggers can be a good thing. They can be learning opportunities for us to do better, to show up differently.
Yes.
And I think if we can just speak honestly without being defensive and see what else there is, because we all have blind spots.
Yeah.
And the people we love the most sometimes can be the most challenging in our relationships.
Mhm.
So I would like to be able to hold some space for people to look at those opportunities differently. That they are opportunities. They could be beautiful learning lessons
Yeah.
if we are open to looking at our part in it, because we have to take 100% responsibility, each of us. There's no 50-50 here.
Yeah. Yeah.
We're
Yeah.
all responsible
Yeah.
for our part in it.
Yeah. And that's actually such a freeing discovery to make is when we take personal responsibility. Because, now, when we tend to slough it off or blame others, that takes control out of our own hands.
Mhm.
But when we take personal responsibility, well, we put the control in our hands of what can I do to help improve this situation or to help get this result or whatever. What can I do? I can't control what anybody else does, but what can I do? And I'll tell you, boy, that's a powerful place to start coming from. And really, and we, what, men, we start discovering how powerful we really are. It's a
It melts years of this, like these walls that are being built, right? Like,
yeah,
walls get built over time, and we feel like the best way to protect our heart is to build walls.
yeah,
But we can't let anything good in either. So, like, we're
that's
not
right.
winning, right?
Yeah,
So I feel like that it's an opportunity and it's a gift, and
yeah,
we don't look at it that way. We look at
yeah,
it that, and too often most of us come from a place where we've been dismissed. So being seen, being validated, being heard for what we need or are experiencing is an important part of healing in
yes,
relationships.
yeah, yeah. Well, Jean, I want to thank you so much for taking the time to have this conversation today and just share from your heart. I am, I really appreciate it. I really appreciate you, and I am excited to get this out there and share it with a lot of folks. So thank you so much.
It's my utmost pleasure, and I appreciate you, Kevin, and thank you so much for having me on your show.
You bet.